before we return to small group conversations is Dr. Rachel Zimmer, a nurse practitioner in geriatrics at Wake Forest Baptist Health, who has a passion for addressing health inequities and food insecurity. Dr. Zimmer, thank you for joining us once again at our Food Security Summit to share important insights from your work.
Hey, thank you all for having me. I'm going to share my screen and start my timer. So today I am charged with speaking about food insecurity. I know that this presentation should not just be about what is food insecurity. So I actually went a little bit further to talk about what are ways that we are trying to address it and what the research says. So I'm just briefly going to define this, and some of the slides you see are actually from the Piedmont Tri-Regional Food Council. I'm also past co-chair. I think I saw Kina, who is the current co-chair of the council here today as well. And so we actually did over the last couple of years, have worked with Creative Carolina Works to do a system-wide food assessment of the region. And these slides are from our partnership with that research. So we defined food insecurity as the state of being when someone does not have reliable access to sufficient quantity of affordable and nutritious food, which we know. But there are some things that I wanted to kind of point out that we found from that research. None of this is going to be a surprise, but communities of color are at least twice as likely to live in poverty as white communities. We know this. There are trends of food insecurity over time. The USDA keeps track of that. And what you see is that food insecurity increased in 2007, 2008 due to the recession at that time. And of course, we are seeing it peak again during COVID-19. From the research, we're finding that locally food insecurity rates are actually projected to increase by 1.5 to 3 times. So all the numbers that you heard earlier, I actually don't expect to see get better anytime soon, might get a little bit worse. And childhood food insecurity rates are actually projected to be 8% higher. So you can see the rates for each of the counties that we looked at to the right, and how that actually coincides with adults who live below the poverty line, the unemployment rate, and then also education levels. And there's a disproportionate number of people that live with food insecurity. So one part of the study that I actually found really helpful is someone had actually brought this up, that data is really helpful. So we partnered with Second Harvest Food Bank to be able to get data by zip code, which so I haven't explained what I do clinically, but one of the things that I do is I'm actually a home-based primary care provider. So I resonated quite a bit, almost cried from the last presentation because I see the issues that food insecurity and poverty have with seniors every day in their homes. And so I completely understand the issue, but a lot of the problems that I was having when I was trying to figure out how to address food insecurity was, where's the data? Like, we could not figure out, like, where are the areas of need? So this assessment has been really helpful for me, because what you're seeing now is for all the counties, what proportion of people who are identifying as Black or identifying as Hispanic are actually food bank participants in each county. And so I have Guilford and Forsyth kind of central to this. And I don't have a ton of time to go into the report, but I did include the link to that report. And then I know that Jennifer Bedrosian is on the call today, so you can actually just send her a little note in the chat if you wanted to. And also, I think it's just worth noting that we actually have county profiles, and there are actually lots and lots of suggestions about how we might address some of the problems in our food system inside of that report. So I highly recommend you to take a look at that. I think you might find it interesting. All right, so I'm going to move into, well, how have I tried to address food insecurity and what does the research say about it? So I mentioned that I provide medical care for people who live in their homes. Well, the other thing that I have done is I started a mobile health program a couple years ago for people who do not have health insurance in the community. And I also am a researcher, and so I look at people who have Medicaid and the impacts of poverty, and even the impacts of Medicaid on their overall health. And also we look at the impact of food insecurity on people's health and what interventions seem to help. So one pretty helpful systematic review that was done in 2020, right during the pandemic. It actually came out in the summer during the pandemic by Dr. DeMarcus, was looking at studies of interventions that were done for food insecurity across the nation. Now, one thing that I've had some conversations with Dr. DeMarcus, and one thing that she pointed out about interventions that address food insecurity is data is kind of lacking. So there are very well-meaning groups of people across the country who are addressing food insecurity, but in many cases, the data is kind of few and far between. There's like a lack of consistency in what measures are used to measure food insecurity or even to measure the impact of food insecurity. And there's also a lack of use of validated measures. And validated measures just means that these measures have been tested and proven to be reliable time and time again in their measurement. So from the evidence that she could find in her group, they found that it seemed like evidence was strongest for home delivered meals to address food insecurity. And the researcher who was highlighted was Dr. Seth Berkowitz from UNC Chapel Hill. He has done a lot of research looking at the impact of home delivered meals on outcomes such as diabetes and emergency room use and hospital utilization for older adults. So I actually bring this up because we started a food prescription program. I do community-based participatory research. And so we were actually I'm going to go back for a second. I have a really good friend who's a pediatrician, and she and I had wanted to start some sort of food prescription program before the pandemic. And so we had started focus groups to get a sense of what could that look like. Well, when March hit, we had this grant money sitting there, and we decided to maybe just go ahead and start something because I see patients in their homes. I knew that their access to food just went down the drain because they rely heavily on people to bring food to them in many cases. And now we had completely isolated them from the outside world. So we were trying to figure out, well, how do we get food to them? And then of course, with Dr. Montez's patients, she's a pediatrician, and there were lots of children who just all of a sudden had to stay home. And we knew that food insecurity was going up for them. So we started kind of a hybrid home delivery meal program. And we did that in partnership with several cross-sector partners. And I actually, we ran that program. I didn't think it would last 4 months, and we somehow funded it for 1.5 years. We ended it at the end of September. And what I came to understand and believe is that collaboration is essential. So when you're trying to think of ways to address food insecurity, I do not believe that one group of people can do it alone. I actually believe that you have to partner with the participants, the people that you're trying to serve. I think you have to get input on what the best type of program would be for them. I think you have to collaborate with the farmers. I think you have to collaborate with health professionals, actually. And I think you also have to collaborate with nonprofits who are already doing the work. And so and the food bank, which is something that we did. So this is actually something else that came out of the research from the PTRC project as well, that we really found that collaboration was a theme that seemed to have the most impact. So I went over this timeline a little bit, but we actually started with groceries and produce. We had a partner, Emma Hendel. She's a woman-owned farmer, Fair Share Farm in Winston-Salem. She actually started putting together produce boxes for us, and we paid her fair price for those. We even went to Costco and talked to the manager and got toilet paper. We were I'd never forget running through Costco with toilet paper. And we actually had a ton of volunteers who just showed up and started delivering meals and produce boxes on our behalf, I was able to secure more funding through grants and federal funding. And we, over time, enrolled 150 participants. I actually think our coordinator is on the call too, Sheena McNeil. She's a social worker and she was amazing. So we actually, she would call and check on the people that we were enrolling in the program, make sure they had DME, which is like walkers or even microwaves, ways to stand up, because we know with older adults, that sometimes they're not even able to stand up to cook what we provide. We actually gave them like a little recipe card based on the produce that was in the box. And then we also partnered with Second Harvest Food Bank to put together meals that were tailored for older adults. So like I said, we were able to do that until the end of September. So I've written a couple papers about that, and I think I have links to them at the end, but I'm happy to share them as PDFs as well, if helpful. So one thing I was going to do is kind of share a video and just kind of talk through that. So I'm going to see if I can stop my share and then share the video, which I have pulled up already, because PTRC did a wonderful job of just kind of capturing the work in action. So what you're seeing are the farmers putting together the produce for the boxes. And what I'm going to do is talk through the research here. So before we enrolled participants into this program, we screened for food insecurity with the hunger vital sign. And then we actually asked people if they would be interested in just answering questions about their food insecurity, their fruit and vegetable intake. And I actually measured depression and loneliness because as the previous speaker had mentioned, loneliness impacts older adults really severely and actually is an independent risk factor for death. So loneliness all by itself what causes earlier death than necessary for older adults. And so I was really interested. We had hired 2 drivers who were wonderful. They were older and retired themselves. And consistently, those drivers would go to the same people every week. So similar to kind of the Meals on Wheels sort of idea, where you have a volunteer who shows up, but we had paid our drivers to go every week to deliver the meals and produce on our behalf. So we measured over time food insecurity, fruit and vegetable intake, loneliness, and depression scores. And we actually saw movement with everything. And I'll go over a couple of those things with you in a minute. Hope of Winston-Salem, which is where Sheena had worked during that, oh, there's Sheena, had worked during that time. They actually provided the cold storage because there's actually quite a lack of cold storage, as you'll see from the PTRC report for produce. And so they were kind enough to let us use their space for packing and for storage. And then what you're seeing here is one of our drivers actually loading up the produce boxes, 2 of our drivers, to deliver each week. So it was quite the collaborative effort. And I'm forever indebted to that team because they were wonderful. And they actually were really upset with me when we ran out of funding. I was upset with me too, honestly. So I'm actually going to stop sharing and then go back to the screen deck or the slide deck here. So what you see here is just an example of our newsletter. So I mentioned our research. I mentioned what we actually looked at over time. We also do qualitative interviews. I'm working on our paper now that talked about that. Sheena actually would call our participants every couple of weeks and just check on, what did they like about the box, what did they not? And we would even ask them, well, what was most impactful about your experience with us? And then we also had interviews that were done and we recorded those and we transcribed those. And now I'm going to kind of write about the participants' experiences with the food prescription program. So we captured the qualitative and quantitative impacts of that program. So what you're seeing here is what we were able to do with food insecurity. So after 6 months, even though we had people in the program for 1.5 years, oh, and I do want to mention, you did not have to be a part of the research to be in the program. We actually only had 31 people who consistently stayed in the research arm in the research of the program, but we continue to deliver to 150 people no matter what, or 150 households. So what you're seeing here is that we actually did impact food insecurity over time pretty significantly. And then what you're seeing here is that we did impact the servings of produce over time as well. This was not statistically significant, but honestly, I was impressed that we were able to move the needle. And this is in line with a USDA study that showed similar impact with food and vegetable intake. The most impactful feedback we got was from the interviews and from the feedback that Sheena would get on her phone calls. So what you're seeing here are paraphrased quotes from the participants. So, people would say, I'm not eating junk food anymore. My doctor's proud because my A1C, which is a marker of diabetes, has gone down and my weight has gone down. And then we actually had a couple of people who died during our program, but their families were so grateful because we were able to provide food during their last days. And we had a son who called us from New Jersey just to thank us because our volunteer was the last person who had seen his mother before his mother had died. And he just had mentioned that his mom was so happy that person had come to see her. So, I believe that there's a lot of work to do, but I'm also really hopeful. I do believe that it takes cross-sector collaboration. I do hope that healthcare providers will continue to increase their interest in addressing food insecurity. And what you see here are actually several of my colleagues and myself and some of the publications that we've put together to try to encourage other healthcare providers and researchers to really look at food insecurity, because we believe that data will help move the needle. But we also want to make sure that our participants and communities' voices, that's my timer, are central to that effort as well. And I put some links and resources in here as well, and I'll stop sharing. Thank you all.
Thank you, Dr. Zimmer. Wow,